Welcome back, everyone. My name is Dave with Lifetech Instructional out of Palm Harbor, Florida. In our previous videos, we already went over adult CPR, child CPR, and also the introduction of CPR, of why we do CPR. In this presentation, we're going to be doing infant CPR. Now, infant CPR is considered newborn up to 1 year of age. So with our mannequin here today, as we're going to demonstrate and walk you through the procedure step by step of how to do infant CPR. Of course, you want to make sure that the scene is safe. Don't put yourself in a dangerous situation. Now, with the infant, we need to check for response. The only way to check for response is you tickle-wickle the bottom of the infant's feet. Hey, baby, baby, baby. Are you okay? Okay, hey, baby, baby. Because that's where they're very sensitive. A lot of nerve endings. They're sensitive in the bottom of their feet. Do not shake a baby's shoulders because you can cause them other injuries. Use their feet. So after checking for response by tickling their feet, we're going to place your cheek over the infant's face now while looking down towards their chest. What we're doing is that we look, listen, and feel for breathing. What am I looking for? Chest rise. Any signs of breathing. Listening for any sounds of breathing that the baby may make. Yes, of course, if there's no response, shout for help, call 911, have someone grab an AED or defibrillator and have them come back. Yes, sometimes you're going to have to point and designate for someone to call 911. Or you can put your 911 on cell phones, because most people have cell phones today, put it on speaker and place it down next to you. Now with the infants, you want to make sure that they're on a firm, flat surface. But let's kind of further more into that. You know that when you are doing adult and child CPR in our previous videos, realistically, you're going to be on the ground. You're not going to be at a table height. But you know, babies are small enough so you can actually pick a baby up, place them on a changing table or a table, and you can do CPR. That's okay to do. Sometimes it's hard to do it on the ground. So make sure they're on a firm, flat surface. You don't have to worry about exposing the chest. If you can expose the chest, then that's great. Sometimes you may not be able to. Get your 2 fingers right over the infant's outfit, start doing CPR. Now, the C part, compressions. Well, how many compressions do we do when doing infant CPR? It's 30 compressions, followed by 2 puffs of air. Now, as we're doing our compressions, as a guideline, we're going to be using our 2 fingers only. Now, it doesn't matter what 2 fingers you use. You can use these 2 fingers, but where your landmark is going to be is a finger width below the nipple line. So as you draw an imaginary line across the infant's nipple line, it's a finger width below, and that is where you're going to place your 2 fingers in doing your CPR. But let's further more into this. You don't have enough strength in your fingers. So you're not going to see this anywhere else, but you could place your other 2 fingers on top of your other 2, and that gives you a little bit more pressure when you're doing your CPR if you need more strength. Now, as we're doing our 30 compressions, you want to make sure that you do not bounce on the infant's chest. You don't have to really worry about your shoulders lined up and arm locked, because babies are small enough, they're more flexible. So you want to make sure that you're pushing down, using the strength that you have with your fingers, pressing down, so that I can get that blood and oxygen flow to that infant's brain. Now, as I release pressure, the heart fills back up again, and then I squish it through. And all I'm doing is continuing motion of pushing hard, deep, and fast. Now, with guidelines, they say, well, how deep do I compress? Well, it's 1.5 inches on an infant's chest. But let's put this into reality perspective. How do we really know we're going that deep on an infant's chest? Do you have a tape measure? Do you have a ruler stick? How do we determine this? We don't. In reality, each and every one of us, we all have different strengths. We all do it differently. So get your 2 fingers on that chest, you push hard and you push deep, and do the best you can. Now, as another guideline, they say that you're supposed to compress 100 to 120 compressions at least in a minute. Okay, let's put this into reality world. Who's going to count? Who's going to look at the watch? Who's going to look at the clock on the wall to see if that person is doing that many compressions? The reality of it is we all have different strengths and we all have different speeds. Do the best you can, pushing hard, pushing deep, and pushing fast. Now, as we're doing our compressions, as I'm going to demonstrate, we're doing 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now, after our compressions are done, we need to open the airway. But when the infants, they're still growing. If I did a full head tilt lift on infants, I will take their neck and I will hurt it. But also, infants' tracheas are very soft. So by doing a head tilt lift, I take their trachea and I will crush and close their airway off. Babies, as an airway, you just keep in a sniffing position only, and that is it. It's only just a really slight head tilt chin lift. That's the A part. Now B part, breathing. Now in previous videos I said, well, how do I know that my breath is going to be effective? Because each and every one of us, we breathe differently. Now when it comes to an infant, we all breathe differently, and so the only way that I know that my puff of air is going to be effective, what am I looking for? What should I see? I should be able to see the infant's chest rise. That's all we're looking for. Now with babies, we're not going to be pinching the nose. Do not do that. Your mouth is going to go over the infant's nose and mouth, and you're giving simple puffs of air. I'll demonstrate it with my own cheeks. Infants just need puffs of air. So as I do my breathing, mouth goes over the nose and mouth, give a puff of air, and look for the infant's chest to rise. So we give 2 puffs of air. Now after my breathing, I go right back and doing my 30 compressions. After those compressions, I give 2 puffs of air. Puff, puff, and then back to compressions. So continue providing 30 compressions followed by 2 puffs of air until either EMIS gets on scene, takes over from there, or if another person is coming and available, they can take over and help doing CPR. Now, in our next video presentations that we're going to do, we're going to go over more extensively with the AED. Can you use a defibrillator on infants and also in small kids? Yes, you can. It's just how it's done differently. But we'll go over that a little bit later. But now, if they start to respond by coughing and vomiting, any secretions coming out of the infant's mouth, we got to stop and place the infant on their side. Now, as you place the infant on their side, remember, small babies' heads are going to be little weeble wobbles. So you have to support their head, placing them on their side to protect their airway. Are they out of the woods? We hope so. Sometimes you may have to sweep the mouth out, put them right back on the back again, and continue doing CPR procedures. Ladies and gentlemen, that is infants CPR. Thank you very much.